as soon as possible.
As you know, back in January, we voted in the House to repeal the Patient Protection Affordable Care Act. That's been sitting over in the Senate since that time. And as long as Harry Reid is the majority leader in the Senate, nothing's going to happen with health care being reformed. Now, understand this. Everyone has seen their insurance premiums go up. That's because insurance companies recognize that at 2013 to about 2018, they're going to get stuck. And so what they're trying to do is milk the American people up front before they get to that point. So it is so important that we can change this that policy, that healthcare law, before 2013, because after that, you're talking about 159 new government agencies and bureaucracies, 11 new taxes, 16,000 new IRS agents. Those are the type of things that are going to kick in as far as this healthcare law. We can go back and we can reform healthcare, but we can do it by using the right type of market principles that put you in charge of your health care and not the government.
There have been some recent court cases about the constitutionality of Obamacare. What is your opinion on whether this is a constitutional measure or not?
I think the most important thing was the 11th Circuit Court of Appeals of Atlanta that ruled that the individual mandate was unconstitutional. And when you go back and you read and study the Commerce Clause and some previous Supreme Court's decisions, the federal government does not have the authority to come down and mandate to an individual citizen that they must go out and buy a private sector commodity. Some people have tried to liken that to automobile insurance. Well, the thing is that you don't have to go out and buy a car. If you do buy a car and you operate on public road systems, then you are required to have automobile insurance. But to say and mandate to the American people that they have to purchase a health insurance or they will be fined, that's not constitutional. And I believe that this will become that.
Thanks. About Medicare earlier, but what do you think?
Excuse me, this is supposed to be people asking questions, not you.
I am asking the people's questions,
I want to
sir.
know whose question is being asked, and I want to hear them ask it, not you.
Is this new
Okay,
voting?
I'd be happy, if you all don't mind, I'd be happy to say whose name it is on each of these questions.
Let them ask their question, you call them.
I'm moderating this, sir, please.
I know
So,
you're doing a bad job.
I'm sorry,
You're
but
doing a bad job of moderating.
the next question is from Dave Hyde. The next question is from Dave Hyde of Palm Beach, who has some questions about Medicare. And he asked if you could expand on what types of things that you could do to get Medicare spending under control.
I think one of the most important things we can do to get Medicare spending under control is we have to move from the fee-for-service to the defined benefit. I think that if you have the defined benefit based upon the income of the individual, that puts them in charge of their Medicare, their plan. Right now, as people are going in, they're getting service from Medicare. They don't know what that bill is that goes forward. So a lot of times you see, you know, a service that was, let's take for example, is $200. They actually bill Medicare for $1,000. And that money does get sent down to the doctor. So we have to have a cleaning up of that system. You know, one of the most important things we have to do is we have to get rid of defensive medicine that is being enacted by so many of our doctors. So many of our doctors are going in requiring people to have X amount of tests that really aren't necessary. And the reason why they're doing that is because tort reform. I mean, one of the key things we need to have, just not for Medicare, but our entire healthcare system, is tort reform. So that doctors can truly go in and do what they want to do in protecting the patient. Now, we talked about the fraud, waste, and abuse in the system. That's one of the key things we have to start looking at and rectifying. There's billions of dollars that we can save there. But as well, let's start talking to some of those medical professionals like I did over here to the group that's been practicing anatomical pathology for quite some time. And how do we streamline and make sure that the co-pays that we're putting on our seniors are lessened? Because every time that a senior goes in and gets one of these pathology tests, that's another little copay. So all of a sudden, you know, the 20% copay that you have, if you're being told you got to have 12 of these tests, it adds up over time. And so we have to reduce those tests. So it's those type of things we need to talk